What if your bandage could talk? At least tells you what's happening under your wounds. Wounds may look small but on the surface, but beneath them, a lot is going on. Changes in pH, moisture and bacterial activity. It's actually can silently slow the healing process, particularly among patients with diabetes, immunocompromised and poor vascular circulation. Delayed wound healing is associated with microbial colonization, biofilm formation and persistent inflammation. Pathogenic bacteria such as Staphylococcus aureus and Pseudomonas aeruginosa, which is anaerobic, unfortunately, most traditional bandage just sit there. They cover the wound but they don't react, don't respond or give us any clues about what really happening underneath. So today we are excited to tell you guys about our new innovation, which is Nano pH Bandage. So let's move on to the next section.
Smart Bandage has a flat, rectangular shape with rounded edges, making it comfortable and easy to apply on the skin. It is made from biocompatible materials, meaning it is non-toxic and safe for the skin. It uses a 3-layer structure. The first layer is a protective layer. The second layer is an indicator layer that can detect changes in pH, while the third layer is a nanofiber layer that helps protect the wound and fight bacteria. The bandage can detect pH levels from 5.5 to 8.5, and it is highly breathable, allowing oxygen and moisture to pass through to support healing. So, how does it work? First, the Nano pH bandage is applied to the wound. When the wound is healthy, the pH is slightly acidic, so the bandage stays its normal color. If an infection starts, bacteria grow and their metabolism increase the pH, making the wound more alkaline. The pH-sensitive dye in the bandage then changes color, giving an early warning of an infection. At the same time, nanoparticles in the bandage are activated and begin to release antibacterial agents. These agents help control the infection while the wound continues to heal naturally.
1000 PVA contact layer mimics the body's natural matrix. Its positive charge acts as cationic shield, disrupting bacterial adhesion while maintaining the critical moisture needed for rapid cell growth. This isn't just a bandage, it's a microbiological defense system. Inside, silver nanoparticles actively fight infection by releasing ions that puncture bacterial membranes and generate reactive oxygen species ROS, destroying pathogens from the inside out.
Simultaneously, our pH-responsive dye acts as an early warning system. It deflects the specific alkaline shift caused by bacterial ammonia production, changing color to alert you to infection before it spreads. All this is shielded by a semi-permeable polyurethane film that blocks external microbes while allowing oxygen to flow, optimizing the bioenvironment for rapid healing. Externally, the breathable polyurethane film acts as a selective barrier. It blocks water and pathogens but remains permeable to oxygen, which prevents the growth of dangerous anaerobic bacteria in deep wounds. By combining nanotech with biology, this bandage doesn't just cover the wound but actively defends it. Next, I will explain about the market potential. First is hospitals and clinics, which represent strong market for Nano pH bandage because they manage a high volume of surgical wounds and traumatic injuries that relies heavily on visual inspection and laboratory testing, which may delay the detection of infection. The Nano pH bandage enables continuous and real-time monitoring of wound condition by detecting the pH changes associated with infection. Second is chronic wound patients, such as individuals with a diabetic foot ulcer. These wounds are slow to heal and highly susceptible to infection, resulting in prolonged treatment. So the Nano pH bandage will provide early warning signs of infection through the pH changes. Third is elderly, which are a key target due to age-related factors such as fragile skin and reduced immune response, which increase the risk of wound complication. A slow healing wound are very common in this population and often go unnoticed until severe infection develop. Lastly is caregiver, which includes family members and professional home care provider. Due to lack of clinical training and diagnostic tools to accurately assess wound status, this product will provide a simply wound management.
Scaling production of the Nano pH bandage is efficient, requiring just 4 standard steps. First, chemical synthesis creates the iridium oxide particles, our high-precision pH detectors. Second, we use screen printing to apply conductive polyethylene dioxythiophene polystyrene sulfonate ink directly onto medical gauze, creating a flexible circuit without expensive electronics. Third, electrode deposition. Lock those sensors into the fabric, ensuring they remain stable and sensitive. And finally, assembly, layering the smart textile with an absorbent pad ready for sterilization. Now, let's talk about the bottom line. We estimate a retail price of 300 ringgit. That might sound like a premium, but look at the real cost of infection. Managing a single diabetic ulcer costs the public health system 6,000 ringgit a year. If that spirals into sepsis or requires amputation, the cost skyrockets to over 100,000 ringgit. Essentially, this bandage is an insurance policy. Spending 300 ringgit now to prevent a 100,000 ringgit catastrophe isn't just better healthcare, it is a financial no-brainer.
The Nano pH Smart Bandage brings many benefits and impacts to the public. It can detect early infection by sensing an increase in pH caused by bacterial activity. This prevents delayed treatment and allows early intervention. The bandage also provides targeted antibacterial action, which is nanoparticle will release antibacterial agents only when the pH changes, which help fight biofilm formation. It will reduce antibiotic misuse and lowers risk of resistance. Additionally, the bandage improves wound healing. It maintains an optimal acidic pH. The nanofiber layer supports the flow of oxygen and moisture. It will reduce unnecessary antibiotic and lower the risk of resistance. From clinical perspective, the Nano pH Smart Bandage lower infection rates and hospital admission. It will improve patients' outcome through early intervention and treatment. Economically, the bandage reduces antibiotic use, hospital stays, and labor, saving healthcare resources and reduce overall treatment costs.
So, as we come to the end of this video, one thing is clear. The Nano pH bandage is not just another wound dressing. It is a game changer. As you have seen through our creative animation and simple explanation, this innovation brings some truly powerful to wound care. First, its early pH change detection allows us to identify problems before they become serious. Changes into visible signal. Second, our hero steps in, a smart nano-based component that actively supports faster tissue regeneration, helping the wound heal better, not just faster. With its smart design, practical benefits and future-ready technology, the Nano pH bandage is ready to bloom in the market and set a new standard.